Let's begin Module 3, and the focus of Module 3 is how drugs affect the driving skill, and then we're going to look a little bit more broadly about DUI arrests and how they can affect family, friends, and even job. It makes a lot of sense to begin this module with a discussion about drugs in the driving skill because in the last section, or in the last module, we actually talked about how drugs affect the human body. So now we're going to apply that to the driving skill and see how alcohol and a couple other drugs actually can affect the tasks and the skills that are necessary for safe driving. We're going to begin with alcohol and put a little bit more emphasis on alcohol and its effect on driving skill, again because that's the drug that people get arrested more frequently for. But then we will talk about some other specific drugs, drug categories, and how they affect driving skills also. Okay, so why is drug driving hazardous, or driving under the influence hazardous? Well, the effects of specific drugs depend on how they affect the brain. But all these drugs that we're talking about impair skills that are necessary for the safe operation of a vehicle. So I would like you to take a couple minutes and think about the skills that you believe are necessary to safely operate a motor vehicle or a car. So take a couple minutes and give some thought to what it is that you need to be able to do to drive a car safely. So let's compare lists. On my list I have skills include motor skills like balance and coordination, the ability to have accurate perceptions about what's going on in your environment. You have to have focused attention to be able to operate a motor vehicle safely. You need good reaction time, and probably one of the most basic skills that's necessary to effectively drive a car or safely drive a car is to exercise good judgment while you're behind the wheel. Even small amounts of some drugs can have a measurable effect on these skills, and then consequently have negative effects on our ability to drive. So let's begin with alcohol and talk a little bit about alcohol and its effect on the brain. Alcohol is a central nervous system depressant, and what that means is it puts the brain to sleep from the outside in. So if we have an understanding of how the brain is affected by alcohol and the functions of the brain that are impaired by alcohol, then we can see how that impairment actually impacts specific driving skills. So let's take a look here. You have a little diagram of the brain there. And this diagram divides the brain into three sections. And the outermost section of the brain is the cerebrum. And then if we move down a little bit further, you'll see the cerebellum. And then in the middle, what is referred to as the midbrain. Now each of those areas, or each of these areas of the brain, control different functions. So for example, in the cerebrum, the outer portion of the brain, things like inhibition, judgment, rational thinking, those are the things that are regulated by that area of the brain. The cerebellum has important function in terms of coordination and balance. Those are very important functions that are regulated by that area of the brain. And then when you go further into the brain, to the midbrain, this is the area of the brain that actually regulates your breathing and your heart rate. In other words, it's the part of the brain that regulates what we call vital functions. And vital functions are those kinds of functions that you really don't need to think about. While you're participating in this course, you don't actually have to sit there and think and say heart beat or lungs breathe. Your brain takes care of that for you. So that's why this area of the brain is so very important, because it regulates the things that are necessary for you to survive. Now, alcohol puts the brain to sleep from the outside in. So in other words, alcohol gets absorbed into the brain from the outside in. And what that means is, as alcohol gets into your bloodstream and gets transported to your brain, it's going to affect your cerebrum first. So consequently, that means that alcohol is, and at pretty low doses, is going to impair judgment, inhibitions, and rational decision making. And interestingly enough, we could ask the question, why do people drive after they have been drinking? And the answer to that question is that the very thing that would tell you not to drive your motor vehicle is the first thing that alcohol takes away. So by impairing your cerebrum and reducing your judgment and your inhibitions, people have the perception that they can drive safely. Then, as blood alcohol concentration goes up, we start to impair motor coordination and balance and things like reaction time. And that's indicative of enough alcohol in the blood, or a high enough blood alcohol concentration, that the cerebellum is now starting to be affected by alcohol. And when we start to affect the cerebellum, we have a relatively high BAC. It's important to recognize that if you would continue to drink beyond putting the cerebellum to sleep, what's left? Well, that's the midbrain, and that's your vital functions. So fortunately, most of the time when people drink alcohol, they don't drink enough alcohol to sedate or put to sleep the midbrain, which regulates breathing and heart rate. And we have some defense mechanisms that try to help prevent that from happening. We can lose consciousness as a result of drinking too much alcohol. We might get some of that inflammation that we talked about earlier in the esophagus and the stomach, and you're well aware that can produce vomiting. So these two things, if you lose consciousness, you can't drink anymore. And if you're vomiting, you're getting the alcohol out of your stomach at least, or the alcohol that's left in your stomach. Vomiting won't do anything to remove the alcohol that's already gotten into your small intestine and then eventually into your bloodstream. So if someone is sick as a result of drinking. Someone is unconscious as a result of their drinking. And if you see their respiration or their breathing is affected by the alcohol, you have a very dangerous situation. This is referred to as acute alcohol overdose. And again, normally you can't drink enough alcohol to sedate that midbrain. But if you're chugging alcohol, if you've already been drinking and you start playing drinking games and you start drinking a lot of alcohol in a short period of time, then you can actually get enough alcohol into the brain that you can actually sedate the midbrain. Another way you can kind of think about this is if you ever undergo general anesthesia, what that anesthesiologist gets paid to do is to regulate keeping you alive and not letting you die by not letting the sedative drug that you've been given affect your midbrain. So if you think about alcohol and you drink to a high enough blood alcohol concentration where you've anesthetized or put the cerebrum to sleep and you've put the cerebellum to sleep, you're about as close to death as you ever want to get. So acute alcohol overdose can result in death. And there are thousands of people that experience that each year. Fortunately, the body has some defense mechanisms to prevent that from actually taking place. So let's take a look specifically then at the blood alcohol concentrations or blood alcohol levels and their specific effect on brain functions. And we're going to begin at the top of that chart that you have with relatively low blood alcohol concentration. And so to give you a frame of reference, remember the per se level of intoxication in Pennsylvania is 0.08. In that first part of the chart there that you have, you can see we're talking about a blood alcohol concentration in the range of about 0.02 to 0.03. For that 150-pound person that we talked about earlier, you know, this would be a couple of drinks in an hour's time. And again, just a reminder, when I refer to drinks, I'm talking about the definition of standard drink. You know, it's not someone who drank 2 or 3 40s. This is someone who drank, you know, the 12-ounce beer at 5% ethanol. But what takes place when your blood alcohol concentration is even at that low level, you start to feel or perceive some of the effects of alcohol. And it might raise your mood level a little bit. You might start to relax a little bit. You might feel some muscle relaxation. So alcohol actually starts to affect the brain at a very, very low dose. If we look at the next range, 0.05 to about 0.06, and again, keep in mind here, we're still below the per se level of intoxication. At this range of BAC, 0.05 to 0.06, many people will experience the euphoric effect that you can get from alcohol, or something that's often referred to as the alcohol high or the buzz. This occurs at a relatively low blood alcohol concentration. So if we follow that along, some other things that start to happen at that time, increased reaction time. And sometimes that is confusing. We often associate an increase in something as being an improvement. Well, in terms of reaction time, increased reaction time is not an improvement. Increased reaction time means it takes you longer to have the appropriate response for a stimulus. So if the light changes red and your reaction time has been increased, that means you're going to be less likely to stop before you go through the traffic light. So again, at this low blood alcohol concentration, we're starting to see some things that can affect driving skills. Certainly, having good reactions is important for safe driving. At this blood alcohol range also, we're starting to see some decrease in motor coordination. So the ability to coordinate motor skills is starting to be diminished. Now let's translate that into the areas of the brain. If we get up to around that 0.06, we have definitely influenced the cerebrum. There's no doubt about that. So judgment, inhibitions, increased reaction time, loss of motor skills, all of those things are starting to happen in this range of 0.05 to 0.06. If someone continues to drink and then get their blood alcohol concentration up to about 0.08, 0.09, at this point in time, alcohol has definitely impaired balance, so we're starting to affect the cerebellum. Speech and hearing have been affected, and again, muscle coordination skills are actually continuing to decline in this range. If an individual continues and gets their blood alcohol concentration up there around 0.14 to 0.15, now we've really gotten enough alcohol in the brain that we're causing gross impairment of physical and mental functions. Physically, you're not operating too well. You know, you may stagger, you may stumble, and your decision making good decisions at a BAC at 0.14, 0.15 is something that's going to be very, very difficult. If you start to get up in that 0.2 area, somewhere between 0.2 and 0.03, this is very severe intoxication. And this is the range where you start worrying about alcohol overdose. Because if you actually could drink to get your blood alcohol concentration up to 0.4 or 0.05, somewhere in that range, you lose consciousness because of coma, and an individual can actually die because of suppression of respiration. You're no longer breathing. Very, very serious situation. So if we go back and we look at those BACs again, and keep in mind the per se level of intoxication being 0.08, you can see that alcohol, because of its effect on the brain and the things that it impairs, that's certainly going to have an effect on our skills to safely drive a car. Let me show you some actual tasks or skills that are necessary for safe driving. And this little chart represents when those tasks or skills are starting to be impaired by alcohol, and at what blood alcohol concentration do some of these tasks, does our ability to carry out these tasks start to diminish. I'm going to go down the tasks first, and I'd like you to think about these tasks and again compare them to what you were thinking about in terms of safe driving. Things like attention, reaction time, good visual function, tracking and steering a car, eye movement control, steadiness and emergency response, coordination, the ability to process information, the ability to have divided attention. You know, it would be nice if you only had to think about one thing while you were driving the car, but there are obviously other cars out on the road. There can be other distractions taking place out on the road. So divided attention, the ability to perceive of what's going on around you and handle all of those situations, changes in speed, changes in lane, All those things are very important for safe driving. And then perception of speed and the ability to accurately perceive how fast you're driving and drive at a speed that's safe for the situation that you find yourself in. So I don't think there's anything on that list that we couldn't agree upon that's not important for safe driving. I think if you look at that list, it's obvious that all of those things go into our ability to drive a car safely. If you look at the blue arrows then that reach out from the right of each of those tasks, what you'll see is at the bottom of the chart ascending blood alcohol concentration. So from left to right it starts at 0.02 going up to 0.14. And what these arrows show you is to the very left of the arrow is when that task is starting to be affected by alcohol. So let's take that back one step further. What that would mean is that's the blood alcohol concentration at which your brain that regulates those tasks is starting to be affected. And if you take a look at attention and reaction time, visual function, very, very low blood alcohol concentration at 0.02, you can see that the ability to perform those tasks is starting to be diminished. Tracking and steering, again, somewhere around 0.03. Emergent or eye movement control, steadiness, your ability to have appropriate reaction time in an emergency situation, around 0.04. Your ability to perform that task starts to decline. Coordination, somewhere around 0.05. Information processing, start to have diminished ability to sense and perceive information and process it effectively at a blood alcohol concentration of about 0.06, and divided attention and speed control at about 0.09. If you look at those blue arrows and focus on the blood alcohol concentration level of 0.08, and again, just re-emphasizing it, that's the per se level of intoxication for driving under the influence. Look how much of that task impairment occurs to the left of 0.08. And keep in mind that the average blood alcohol concentration for people arrested in Pennsylvania for DUI is around 0.17 to 0.18. That doesn't even fit on our chart. So those tasks, when you start getting to blood alcohol concentrations above 0.05 and obviously below 0.08, you can see that there is a lot of impairment of the tasks that are necessary for safe driving. Let's look a little bit more specifically about alcohol and talk about some of the skills and tasks again in a little bit more detail. Judgment we've already talked about. Well, what is good judgment? Well, it's the ability to make sound and responsible decisions. That's important to operating a vehicle safely. So alcohol affects those functions, those decision-making and judgment functions first. Judgment is the first thing that is diminished by alcohol, which means reason and caution are quickly reduced. And judgment can be affected at a blood alcohol concentration as low as 0.02. Just to connect back with our discussion about alcohol and the body, what I'm hoping that you are starting to experience or see in this course is that we tried to take a lot of information about alcohol in the body and drugs in the body and discuss those kinds of things first so that you have a good understanding of blood alcohol concentration I hope you have a sense of what a .02 means in comparison to a .08 or to a .16 now, because what we're trying to do now with this module is we're trying to apply that information that we talked about, drugs in the body and how the body is affected. I hope that now that it makes sense that when we talk about a blood alcohol concentration as low as .02, it can actually have negative effects on a very important task that's necessary for safe driving. Next one we're going to look at is concentration, the ability to shift attention from one point of action to another. And we talked about that with divided attention. So alcohol, or said another way, a little bit differently, alcohol impairs your ability to concentrate on multiple tasks when you're driving, such as vehicle speed, position of the vehicle, other traffic on the road, and then you throw in operating your sound system and turning on your radios and managing your DVDs and answering your telephones, and hopefully you're not texting while you're driving, even participating in conversation. Things that you could probably handle very well or handle safely when you're under the influence of alcohol, because your concentration is impaired. It leaves the driver really challenging to address all of these different things that are taking place. And as your blood alcohol concentration goes up, you really become limited to focusing on a singular action when you're driving. And again, that's dangerous because of all the things that are taking place in your car, outside of your car, on the road, around you. Coordination. What's coordination? Well, it's the ability to control motor skills. Alcohol impairs the ability to coordinate motor skills, fine motor skills. We talked about when we looked at the BAC chart, like putting your key in the ignition, up to gross motor skills, like walking to the car. These are indications that alcohol is starting to affect the area of the brain that regulates your coordination. And to me, I think it's interesting if you were actually walking to your car and you were not under the influence of a drug, and you were having trouble coordinating your movement and your skill, but your brain was still functioning the way it should be, I think you might have the reaction of, gee whiz, what's going on? Why am I stumbling? Why can't I manipulate my keys? So your judgment, because you haven't taken a drug that takes away your judgment is still there, so you become concerned about those things that you're experiencing. And I think under those circumstances, it's probably very likely that you would say to yourself, maybe I shouldn't be driving now. If I'm fumbling with my keys and dropping my keys, I can't get them in the car, or I can't hit the right button to unlock my car, and I'm stumbling just trying to get in my car, something might be going on, and maybe I shouldn't be driving. Well, this is the irony with alcohol. The very thing that would tell you that these warning signs are indicating that you shouldn't be driving your car are the first things that are taken away by alcohol, and that's your judgment and your decision making. So loss of coordination really affects your reaction time, how quickly you can react, and your overall ability to react in a positive way by handling the car or steering the car. So ability to react is affected when your coordination is diminished. What about vision and hearing, the ability to see and hear clearly? Alcohol can reduce visual acuity up to about 32%. And if you would go back to that chart that we just looked at that shows the progression of alcohol impairment at BACs and what functions are affected at a specific BAC, you'll see that vision and hearing, if you're starting to get blood alcohol concentration 0.08, 0.09, 0.10, you're starting to affect your ability to see and hear clearly. What happens in terms of vision is when you're under the influence of alcohol, you develop what is referred to as a tunnel vision. And many people I've talked about talked to in alcohol safe driving school, actually they have thought that was a positive thing. They said, you know, I'm going to get in my car and I'm going to be very focused. I'm going to concentrate on that line. I'm going to make sure I don't go over the line. Well, actually that focus of attention is actually detrimental to safe driving. You need good peripheral vision while you're driving a car. You know, you need to be able to check to your left and check to your right. Also, one of the effects of alcohol in the eyes is it dilates the pupils. So an example would be you're driving on a two-lane road and headlights, bright headlights, hit you in the eyes from the other side of the road. Normally, what would happen is your pupil response would be rapid, and it would help reduce the impact of that bright light. When you're under the influence of alcohol, your pupils don't dilate as quickly. And this is something that police officers may also use. Maybe you experienced this in your field sobriety test. They may have taken a light and shined it in your eyes and then moved it away and then shined it back in your eyes to see how your pupils are responding. Another task, obviously, we've touched on this one, that's important to safe driving is having good reaction time. What is good reaction time? Well, it's the ability to see, not only see, but understand a situation, you know, to comprehend what's going on, and then take appropriate action. And I think we've all had experiences when we're driving cars that things happen out there and they happen very, very rapidly. And sometimes you have to react very quickly. But you also have to have the ability to understand what's going on in that situation and comprehend that. and that's something that's going to be influenced by your ability to make a good judgment of what's going on and around in your environment. And so you might see something that's happening, but if your brain isn't at the level where you can actually understand what's taking place, it's going to be very, very difficult to take the appropriate action. So reaction time is severely reduced due to impairment of comprehension and coordination. Your reaction time as your blood alcohol concentration starts to get up there above 0.05 can actually be reduced from 15 to 25%, and this has the potential, obviously, to contribute to crashes that take place. Comprehension, which I just touched on a little bit in talking about reaction time, is really the ability to understand situations. And here more specifically, when we're out driving on the road, there's a lot of road signs, there's a lot of signals. We need to be able to see them and comprehend them and understand what they mean. Alcohol impairs a driver's ability to interpret situations and signs and signals, which a driver must understand or respond to quickly, actually, to be safe on the road. So when our comprehension is diminished by alcohol, it leaves the driver easily confused, not able to respond to emergency situations, or sometimes even the ability to understand the meaning of simple signs like running through a red light. You know, you don't comprehend that the light is red, and obviously set up a very dangerous situation by going through a red light. So those are some specific examples of how the tasks that are necessary for safe driving can be severely impaired by blood alcohol, by an ascending blood alcohol concentration. Let's talk a little bit about some other drugs in driving. And like alcohol, many drugs have the ability to reduce a driver's ability to have full control of their car. And drugs other than alcohol do have some different and profound effects on a person's mood, behavior, and physical and mental skills. So let's talk about some examples of some other drugs. Marijuana, and when we talked about marijuana and the body in the prior module, we did identify that after alcohol, marijuana is the second most common drug that people are getting arrested for driving under the influence. And in terms of the evidence about marijuana and driving, there's a lot of evidence from both real experiences that people are having out on the road, as well as simulated driving studies in the laboratory, where under a controlled situation, people's ability to perform the tasks for safe driving and they're under the influence of marijuana have been evaluated and assessed. And from both real life experience and from simulated driving studies, there is no question that marijuana can negatively affect a driver's attentiveness, perception of time and speed, ability to draw on information obtained from past experiences. So these are three very clear outcomes that can come from smoking marijuana and the effects of marijuana on the brain. And so obviously drivers' attentiveness, perception of time and speed, and ability to draw on information from past experiences are very, very, very important when you're driving a car. For example, perception of time. I've had police officers tell me that they observed a car stopped at a red light, and the driver sat there and went through 3 cycles of green, yellow, red, green, yellow, red, green, yellow, red. Well, most people don't do that, and that can constitute reasonable suspicion, as we talked about in terms of DUI in the law. And that made this police officer suspicious, and he pulled up behind the car and got out and spoke to the driver and said, why are you sitting here going through all these cycles of the light? And he said, well, I'm actually just waiting for the light to change. And he had really no perception of the time and the changes in the lights. Automatically cued the driver, or it automatically cued the police officer to think driving under the influence and driving under the influence of marijuana. Police officer was correct, and the individual was arrested for driving under the influence. Another important thing about marijuana and driving, all of the impairments related to driving that marijuana caused are significantly magnified when marijuana and alcohol are combined together. So here's an example in terms of polydrug use and specific driving skills. Alcohol intensifies all of those negative effects that marijuana has on the tasks and skills that are necessary to drive safely. So driving under the influence of marijuana is dangerous enough, but combining marijuana and alcohol makes it even more dangerous. Opiates and opioids in driving. Opiates and opioids are heroin, opium-like substances. Opiates are the naturally occurring drugs from the poppy plant, and so obviously opium, morphine, these are natural opiates. What natural opiates means is that the drug actually comes from the plant. We don't have to do anything to create that chemical that acts like a psychoactive drug. It's naturally occurring in a plant. Another example of that, we just looked at marijuana. Marijuana is a natural drug. And that means that the THC, which is the active ingredient in it, it's part of the marijuana plant. You don't have to try to manufacture it. Opioids, are synthetic drugs that act just like heroin. And these are drugs that are created in the laboratory. And so Oxycontin, Vicodin, they act like heroin, have the same kinds of central nervous system effects as heroin and other effects in the body as heroin, but they're not derived from the opium plant. They're actually created in the laboratory. So that's the difference between the opiates and the opioids. But both of them can cause drowsiness, mental confusion, and visual impairment at low to moderate doses. When we talked about drugs in the body, I emphasized that these are very powerful, very strong drugs. And so the impairment that can come from taking these drugs can occur at a very low or moderate dose. Implications for the driver. Driver may have difficulty keeping the vehicle in the correct lane, and again, errors in judgment. Let's go the other way. Let's talk a little bit about stimulants in driving. Cocaine, amphetamine, caffeine, these are all examples of stimulant drugs. They can interfere with concentration, impair vision, and increase a driver's tendency to take risks. And that's a real interesting outcome or effect of stimulant drugs. Stimulant drugs can raise our confidence level. After taking stimulant drugs, people can become more aggressive. Drivers who have been taking stimulants can be more aggressive drivers. When you become more aggressive, you're more likely to take risks. So stimulants have kind of their own little, unique aspect in that, in terms of driving skill, in that you feel like, and your confidence level is high that you can drive the car, and you can drive the car safely, and that leads you to think that you can take risks, maybe pull out when you really shouldn't, or pull over when you really shouldn't, and it contributes to more aggressive driving. Let's take a look at hallucinogens. And hallucinogens include drugs like LSD, psilocybin, which comes from a specific species of mushroom, and mescaline, which comes from the peyote cactus. And they can affect hearing and sight, as well as the perception of time, distance, and movement. And they can make a person sense things that really don't exist. So this is in a state where you can't judge distance and movement, your perception of time is distorted, and you're not sure if something is really there or it isn't there. This is not a good time to be driving an automobile. To give you an example of how hallucinogens can affect sensation and hearing and sight, there's a phenomena called synesthesia. And what synesthesia does is it distorts your perception of sound and color. So normally you see color and hear sound. When you're under the influence of hallucinogens, what happens is color produces sounds. So you're looking at color and you're hearing sounds. When you're hearing sounds, you get perceptions of color. In other words, the connection between sound and color somehow gets reversed in the brain, and colors now produce sounds, and sounds now produce color. I would suggest that that's not gaining insight or having an insightful experience. That simply means that your brain functions have really been distorted by these drugs. To draw closure on our discussion about drugs and driving, I'd like to just give a few examples of some prescription and over-the-counter drugs that can negatively affect driving. For example, taking antidepressant drugs that produce a sedative effect even 10 hours before driving can be equated to driving under the influence of alcohol. 10 milligrams of Valium can cause greater driving impairment than a blood alcohol concentration of 0.1. Sleeping pills, which are over-the-counter sleeping pills, prescription sleeping pills, which are very highly advertised now. Sleeping pills can slow down the central nervous system. They cause drowsiness, diminish reaction time, and these are drugs that also impair the ability to concentrate. So in general, I think what we can say about this section of Module 3 is that drugs that you take, whether they be alcohol, prescription drugs, illegal drugs, or over-the-counter drugs, can fool you into believing that you are in control of driving your car when in fact you're impaired.